Hello, I'm Dr. Rajitha, faculty of Next Fellow. So today's topic is on superficial and deep peroneal nerve. So first we shall begin with the superficial peroneal nerve. So superficial peroneal nerve, it begins at the bifurcation of common peroneal nerve. So here we can see this is the common peroneal nerve which bifurcates at the neck of fibula. Common peroneal nerve is otherwise called common fibular nerve, and when it bifurcates, the superficial peroneal nerve runs laterally, which is otherwise called superficial fibular nerve. So superficial peroneal or superficial fibular nerve, it lies deep to peroneus longus muscle. We can see a twig giving off to peroneus longus. So it lies deep to peroneus longus muscle and peroneus brevis muscle, and further it lies below deep to extensor digitorum longus, and where it pierces the deep fascia in the distal third of the leg. You can see here the blue colored structure is the superficial structure where it pierces the deep fascia at the distal third, means lower third of the leg, and it supplies peroneus longus, peroneus brevis, and because it is a lateral compartment nerve, so it supplies both the lateral compartment muscles, and it also supplies the lower leg and most of the dorsum of the foot. So the blue colored here, the lower leg and most of the dorsum of the foot is supplied by the superficial peroneal nerve. We can see dorsum of the foot here, except the first web space, that is between the great toe and the second toe. So except that area, rest everything, the dorsum of the foot is supplied by superficial peroneal nerve, and lateral most part of the foot is supplied by sural nerve. So the cutaneous supply, it is the yellow colored one is the lateral compartment. This is the medial side, this is the lateral side. So upper part of the leg is supplied by common peroneal nerve. Superficial peroneal nerve with the root value L4 to S1. It supplies the dorsum of the foot and lateral part of the lower third of the leg. And lateral side of the foot is supplied by sural, and medial side and anterior side of the leg is supplied by saphenous nerve. So we can see the branches here from the superficial peroneal nerve, which is distributing along the dorsum of the foot. So the branches of superficial peroneal nerve supply the skin on the dorsum of the foot and also all the toes except the lateral side of the fifth toe. So except the lateral side of the fifth toe and adjoining sides of the great and second toes, that is at the first web space, and it is supplied by where this first web space, it is supplied by deep fibular or deep peroneal nerve. Let's talk about the clinical aspects of superficial peroneal nerve. So lesion to superficial peroneal or superficial fibular nerve causes weakness of foot eversion. So the person won't be able to do eversion, outward movement of the foot, and there will be also sensory loss on the lateral aspect of the leg, so that extends along the dorsum of the foot except the lateral side of the foot and the first web space. Rest of the dorsum we know it is supplied by superficial peroneal nerve. And the compression of the nerve, that is the entrapment of the nerve, because it penetrates the deep fascia of the leg, so that is the reason it may be involved in the entrapment. And also the reason for compression could be the compartment syndrome. So the reason for compression could be the compartment syndrome, which is called lateral compartment syndrome of leg, and this occurs because of like the lower leg is it is covered by a tight sleeve of the fascia. So as the pressure increases within the non-extensible space of the limb, so this compromises the circulation because the blood vessels may get compressed and the functions of the tissues are lost within that space. and also this may lead to necrosis because of compression of neurovascular structures, and that is the tissues death, cell death, and subsequently they cause disruption in the circulation, and because of lack of oxygen. If it is not diagnosed and treated appropriately, it may lead to permanent cell death. So that is about the lateral compartment syndrome involving superficial peroneal nerve. Let's talk about the deep peroneal nerve or deep fibular nerve. It begins at the bifurcation of common peroneal or common fibular nerve at the neck. So we know one branch is the superficial peroneal nerve, we just did it, and this is the deep peroneal nerve which runs. So deep peroneal nerve is the nerve of anterior compartment of the leg, and it passes obliquely. We can see here it runs obliquely forwards deep to anterior compartment muscles, that is extensor digitorum longus. It passes deep to extensor digitorum longus in front of the interosseous membrane and reaches the anterior side, like it reaches the anterior compartment along with the anterior tibial artery, and proximal, that is at the it is related to the anterior tibial artery in the proximal third of the leg, and it descends with the artery till the level of ankle. So after descending, where it divides into lateral and medial terminal branches, we can see here lateral and medial terminal branches. As it descends, the nerve of is first lateral to the artery. It runs first lateral to the artery, then it crosses along the anterior side and finally becomes lateral to the ankle. It supplies the muscles of anterior leg compartment, that is tibialis anterior. We can see here its distribution. It supplies tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. And in the foot it supplies extensor digitorum brevis and dorsal digital cutaneous nerves, where it supplies the first web space. Here it is shown, it supplies the first web space. So that is about the nerve supply, distribution of muscular and cutaneous branches. It also gives articular branches to the ankle joint because it crosses the ankle joint from front. Cutaneous supply. So we can see the cutaneous supply of deep peroneal nerve. It supplies in the first web space. So here we can see this is the deep peroneal nerve, which is the nerve of anterior compartment, goes to the first web space, and rest of the dorsum we know it is supplied by superficial peroneal nerve. So the lateral terminal branches crosses the ankle deep to the extensor digitorum brevis, and sometimes it gets enlarged to form a ganglion called as pseudoganglion and supplies extensor digitorum brevis, and then it supplies the first web space, that is in the dorsum of the foot. So now, like going to its clinical aspects, anterior compartment syndrome. So here we can see an image of anterior compartment syndrome, which is an isolated injury of deep fibular nerve. Similarly, we saw just now lateral compartment syndrome, which is because of superficial peroneal nerve. So deep fibular or deep peroneal nerve will get compressed in anterior compartment syndrome and affects the anterior compartment of the leg, and or intraneural ganglion cyst. It forms cyst which is called intraneural ganglionic cyst. Intraneural ganglionic cyst is a non-neoplastic gelatinous cyst, and which can be found in the epineurium of the peripheral nerve, and early diagnosis and appropriate surgical treatment of this condition is better key for the successful outcome. So that is about the intraganglion neural cyst or ganglionic cyst, which is like a gelatinous cyst. So what happens in anterior compartment syndrome? All the anterior compartment muscles helps in dorsiflexion of the foot. So the person foot will be foot drop, like plantar flexed. He won't be able to do dorsiflexion. So weakness of ankle dorsiflexors, extension of all toes will be also weak, but foot eversion will be normal, because eversion, it is because of peroneus longus and brevis, and inversion is because of posterior tibialis muscle, tibialis posterior muscle. So inversion, eversion won't be lost, they will be normal, but there will be weakness in the ankle dorsiflexors and even the extension of toes, because extensor hallucis longus, extensor digitorum longus, extensor digitorum brevis, all these are involved. And also there will be loss of sensation in the first web space. We know that is the cutaneous supply of deep peroneal nerve. So there will be loss of sensory supply to first web space. So this completes. Now let's do a short summary of superficial peroneal, deep peroneal and even the common peroneal. So we are dividing, this is a schematic image for you all to understand. So we are dividing two lines along the course of the nerves, and above to the line it indicates the popliteal fossa. Here is the leg region and foot region. So first we shall begin with the common peroneal nerve. So common peroneal nerve gives rise to sural communicating nerve. This is sural communicating nerve. It also gives rise to lateral sural nerve, which supplies cutaneous supply to the upper part of the leg laterally. Sural communicating nerve goes and joins with the sural nerve, and these 2 to 3 branches of genicular nerves which supply the knee joint, and also it supplies to superior tibiofibular joint, articular branches to superior tibiofibular joint. So these are the branches given off by the common peroneal before terminating into superficial peroneal and deep peroneal. So this is the superficial peroneal and this one is the deep peroneal nerve. Let's see about the superficial peroneal distribution. It supplies lateral compartment, so peroneus longus, peroneus brevis. So this is peroneus longus, this is for peroneus brevis muscle, and then it pierces the deep fascia and becomes superficial, where it supplies skin along the lateral side of the leg, lower part of the lateral side of the leg, and further it continues and divides into branches to supply the dorsum of the foot. So these branches are meant to supply dorsum of the foot. Next, about the deep peroneal nerve, it supplies anterior compartment muscles of the leg. So it is the nerve of anterior compartment. So it supplies tibialis anterior, it supplies extensor hallucis longus, extensor digitorum longus, peroneus tertius. All these are anterior compartment muscles. It also gives some articular branches to the knee joint, and it further supplies extensor digitorum brevis, and finally it terminates by supplying into first web space, that is the lateral branch of it continues to supply first web space. So this is the summary of common peroneal, superficial peroneal and deep peroneal nerves. Let's do some MCQs. Deep peroneal nerve sensory supply. I hope you will be knowing the answer now. So first web space, fifth web space, anterolateral dorsum of the foot, lateral part of the leg. So the answer is obviously the first web space.